from the American Academy of Pediatrics.
Sometimes I wish I had my pediatrician on my favorites, or just a fellow pediatrician who has more experience than I do on the parenting front. Guess what, guys? Today we have with us one of those amazing mom pediatricians who is going to answer our questions. My questions and the questions you sent in.
Some babies skip the crawling stage completely. Some babies will army crawl and kind of slither on their stomachs and pull themselves with their arms. Some babies will crawl with one leg and let the other one kind of lag behind. And then some babies will scoot backwards. For most babies, this is all okay. So as long as your baby can move each limb independently, equally, then that is a good sign.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. And this week, again, we really mean it because the questions came from you. Let's get started on another Ask the Pediatrician episode. Today, I'm talking to Dr. Jennifer Shu. She is the medical editor of healthychildren.org, a practicing pediatrician at Children's Medical Group in Atlanta, Georgia, and a mom. Welcome again, Jennifer.
Thanks for having me back on the show, Edith.
Yeah. So we have so many good questions that our audience sent in. So let's just do it, shall we?
Okay, sounds good.
All right, first one. My kids are always bringing home candy from Halloween all through the holidays. How can I make sure that they don't eat too much candy?
That's an excellent question. You know, my kids are bringing home candy all the time. It's somebody's birthday, it's Valentine's Day, Halloween, whatever the case may be. And I think what parents should do first is figure out how much they feel comfortable having their kids eat per day. One rule of thumb I give my patients is if half of what you eat are fruits and vegetables, then that's a really good guideline to follow to try to have a healthy diet. 1/4 should be protein, 1/4 should be grain, and then some calcium like milk on the side. And then a small amount can be your treat. So maybe decide if it's like 100 calories, something like that per day, 100, 200 calories per day, or just a really small proportion of what they're eating can be treats. Another way to look at it is maybe 80% healthy foods, 20% treats. And that could be your candy. It could be your ice cream. It could be juice. It could be a sweet beverage. So just really kind of keep that all in mind. And then for things like Halloween or holiday candy, you might just decide this is how much you can have per day and portion it out for them. And whether the child wants to eat it first thing in the morning versus at the end of the day, it's up to them. But that's what their quota is or their ration, and then let them decide. And if it gets out of control, some people will do a trade-in program like a Switch Witch, where you give parents all your candy and they give you Legos or another toy or something that they like in return, a non-food item.
I had never heard of that trade, and it's such a good idea. I feel like even my 3-year-old would understand that. Okay, we're going to trade this in for this.
Yeah. It's good for kids who have a hard time regulating themselves, and then they make the decision, okay, I don't need the candy, but I really want this toy.
Love it. I love it. I love it. I love also that you're approaching it from, the long game perspective. We're not just talking about one day where we went out trick-or-treating or we went to a holiday party, right? Just thinking about the season that we've been in since the end of October. But we're thinking, on a day-to-day basis, how to manage this at home. So that's super helpful. Let's move on to the next question, Jennifer. This listener wrote in, our family's going on a cruise this winter. How can I make sure we don't get sick? I'm especially worried about RSV.
Oh, so fun. So I think the first thing to do is to make sure that everyone in the family is vaccinated and up to date with everything that they're eligible for. And that's routine childhood vaccinations. Flu and COVID are good things to get. And if your if your baby's eligible for an RSV vaccine, or older adults might be eligible, those are good things to talk to your doctors about to make sure, first of all, that you're up to date. And then hand washing is really important. Think about shared objects that people are touching, whether it's doorknobs or a buffet when people are touching the same, spoons and drink machines. Lots of hand washing. There may be hand sanitizers around. If you're sick, I would try to avoid being around other people or wear a mask. But basically, the common sense things about good hand washing, especially before eating and after using the restroom, and anytime your hands look or feel dirty.
Yeah, especially on cruises, right? I don't know how excited you have been. I have been maybe a little too excited, but for new moms, new parents who worry about RSV, it's been so nice to be able to offer them immunization for the past 2 seasons. I mean, we're talking about kids under 1 can all now be protected in this season and perhaps a second season if they have a qualifying medical condition. Have you been as excited as I have been, Jennifer?
I mean, it's such a game changer, right, Edith? Because we've never had this available to us before, and it can really help prevent small children from getting sick. And you and I probably have both had kids who have had RSV end up in the ICU. And not only is it really scary and difficult medically for the kid, but it can also be really expensive. So I've had so many parents opt for the RSV shot for their new babies.
Yeah. So hopefully that helps this parent that wrote in with this question.
So just to clarify for our listeners, what we're talking about is a shot called nirsevimab or Beyfortus. And these are monoclonal antibodies, meaning they're already formed antibodies that we give to babies, and that gives them protection against the RSV virus. This differs from the vaccines that people over the age of 75 might get, or pregnant people from 32 to 36 weeks during certain months of the year, they can get the RSV vaccine. Those vaccines actually provoke your immune system to make the antibodies, whereas the shot that we're giving to babies, we just give them the antibodies directly.
Thank you for that, Jennifer, because I get so excited about even having something that I can give my little babies to protect them that I didn't clarify that for our listeners. So thank you for that. Let's move on to the next question. My baby's due date is next week. Congratulations. I'm worried about traveling with a newborn for the holidays. When is it generally okay to take a new baby on a plane?
So that's a good question, especially for babies born around the holidays, like you mentioned. In general, if a baby is healthy, meaning no medical issues like a heart condition or lung problems, they probably can fly after about a week of age or around the time that they reach their birth weight again. So it's normal for babies to lose some weight, then gain it back as the body's settling down immediately after birth. Once all those things kind of stabilize, a baby probably is safe to fly from a medical standpoint as long as you get some kind of approval from your pediatrician. So around a week of age minimum, I would say. The one thing I want to emphasize, Edith, is that even if it is physically safe and medically okay to travel, you may choose to wait a little bit longer because babies who get sick with a fever within the first month or 2 of age can get sick with infection really quickly. And that might land you a visit to the emergency department or the hospital where the baby has to get blood work and a chest x-ray and maybe urine test, possibly even a spinal tap, which is a lumbar puncture, because we're so concerned when a baby does get a fever. So think to yourself, is this travel really necessary? Do I want to bring my baby to crowds where they could potentially get sick and need a serious workup or have complications of an illness?
Yeah, it's such a personal risk-benefit analysis that you have to do as a parent, right? On the one hand, yes, in theory, after the first week, as you mentioned, they're okay to travel, but the risks are also real in that if they catch some sort of virus or other illness, they will be taken very seriously because of how little they are by the doctors evaluating them. And that means a big workup, most likely, right? So hopefully, again, that's helpful to the listener that wrote in with this question. Next up, we have a question about a 7-month-old who has started to pull herself along the floor on her belly in a sort of army crawl, but hasn't started crawling on all 4s yet. Is this normal, Jennifer?
So absolutely it can be normal, Edith. So a lot of times we'll see babies after age 6 months start to try to go from a sitting position to leaning forward, maybe going to reach for something and eventually crawl on all 4s, then pull to stand, then start walking. Some babies skip the crawling stage completely. Some babies will army crawl and kind of slither on their stomachs and pull themselves with their arms. Some babies will crawl with one leg and let the other one kind of lag behind. And then some babies will scoot backwards. For most babies, this is all okay. So as long as your baby can move each limb independently, equally, then that is a good sign. And they have just looked for the path of least resistance in trying to move forward or backwards, as the case may be. But if you have any concerns that your baby might be weak on one side or weak in one extremity, definitely check with your pediatrician.
Absolutely. But yes, I totally agree. In general, they really get to where they want to get to. They figure it out.
Now, some babies will roll to where they need to go, right?
Can I just tell you that I have videos of William, who's now 3 years old, rolling? He would just roll to one side, then roll to the other, then roll at an angle until he got to where he needed to be.
It worked for him. Super cute. So cute.
It did. It is so cute. Jennifer, the next question we have, I actually, really wonder about this myself as well. What are the best non-toxic cleaning products to use for bottles, pacifiers, teethers, etc., to protect kids from germs, but that would also be safe for infants?
Mm-hmm. So that's a good question. I think in this case, less is more. You really want to try to avoid harsh chemicals as much as possible, especially if you can't clean them off of the surface that the baby might be putting in their mouth, like a pacifier. So you really don't need fancy antibacterial this and that. Hot soapy water, like dishwashing liquid with hot soapy water, can be good. Throwing your things into a dishwasher, especially if you have like a little basket that can hold small parts, that's another option. People may want to use like a sterilizing machine, for example, or just throw these objects into boiling water for a few minutes to sterilize. And really, that's the purest way of doing it because it's just using water.
I did exactly that, Jennifer. Soap and water and sterilizing machines. Now, I do have to tell you, and this is a little bit of a detour and not something that our audience wrote in about, but something that I wonder, and I'm just going to take the opportunity to ask you, what about plastic things, right? Bottles, pacifiers, all of those things being heated up constantly. Like, I'm just starting to really worry about plastic in our homes in general and trying to minimize it. And also going out of my way to not heat up plastic. Am I crazy, Jennifer? Are you also reading the evidence and coming to the conclusion that we need to be careful about plastic?
Yeah, I think the concern is that certain chemicals can leach out of the plastic and go into water and then just create potential health problems down the road. So yeah, if you can avoid plastic or avoid heating plastic as much as possible, that is ideal. Using glass or stainless steel type of containers may be another option. But yeah, I think the prevailing opinion is to try to avoid heating plastic if you can avoid it.
Yeah, love that. I'm not crazy for everyone at home listening.
You're not crazy at all.
Okay. And then this one actually did come from a listener, but is also a question I have myself. What is the best way to react when your toddler hits another child?
Okay. So anytime a child does something you don't want them to do, I think it's important to have a measured response, and it should equal the severity of the situation. So let's say a child runs into the street. Yes, that's a time that you kind of want to freak out and shout and grab them and pull them away from danger. But sometimes if it's something that's a less major infraction, maybe they're hitting a child and it's not doing a lot of harm, you don't want to get too excited, because sometimes kids like to get a rise out of you or see if they can make you excited again. Like, oh, I made my mom mad. Maybe I can try it again and see what happens. So I think calmly saying, we don't hit, or we use soft touches, or whatever terminology you want to use. Hands are not for hitting. And then you really want to separate the hitter from the victim. And I usually like to say, shower the attention on the victim, give them good attention, and kind of give the person who did the hitting a little bit of the cold shoulder. Oh my goodness, are you okay? Are you hurt? Let me just check you out. And, let's make sure that you're going to be fine. And then give the hitter the cold shoulder for just a minute, and then go over to them and make sure you talk to them about how we don't hit. It's not nice to hit. It hurts when we hit. Yeah. If it becomes a repeated problem, that's when you really have to separate the child from the person that they're wanting to hit. If you, or let's say a childcare teacher, can see that a child is about to go hit or bite or whatever the unwanted behavior is going to be, try to redirect them. We want to really prevent or preempt any kind of bad behavior if at all possible. And then be calm, separate them, make sure the victim is okay.
Yeah, I love that. And one thing that has worked really well for us, in addition to all of the things that you mentioned, is really trying to give alternatives, right? Like, is it coming from a place of frustration? Is it coming from a place of not having the language? Can we give the language, right? So for William, for example, it is much, much less of an issue now. But when he was about 2, between 2 and 2.5, he was hitting. And what I realized is that he was frustrated when he wasn't being heard. So for example, someone came to give him, and by someone I mean another 2-year-old, came to give him a hug, right? And he was like, no. And the other 2-year-old gave him a hug anyway. So then he pushed and hit. So, it's understandable, but doesn't mean that it is behavior that I want repeated. So what language can I give him? And for him, we worked on no thank you, listen to my words. And the next step was going to the teacher and saying, he's not listening to my words. And that worked really well for us. I have to tell you, he's used it against me. He goes to my...
You're not listening to my words, Mom?
Yes, correct. He goes to my husband and says, Mama's not listening to my words.
Oh my goodness. Student becomes the teacher. I love it.
But the alternatives have been so, so helpful for us.
I like my turn, please, or can I have a turn?
Yes.
So I love that, the solutions. And sometimes the solution is, if they're fighting over a toy, either nobody gets a toy or they each get the same toy. Like, so have extra around.
Yeah. For my son and my nephews, we buy things in 3s, which mean they cannot be very expensive, right? Because we have to buy 3 of them.
But they're not going to fight over them.
They will not.
The other thing is, catch your child being good. So if you notice that they are playing nicely together, I love how you're sharing. I love how you're playing nicely together, and kind of praise them before they even get a temptation to act out.
Yes, I love that. And we're fostering the positive traits here. This is always such a treat. I get to ask all my questions, and I want our listeners to have the same opportunity. So send any and all questions to podcast@aap.org. That is podcast@aap.org. Thank you so much, Dr. Jennifer Shu, for joining us today.
Always good to be on your show, Edith.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos, Kathy Jewell,
Doug Nagel,
Jackie Ortega, Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. This episode wraps up our 3rd season. Can you believe it? But we'll be back soon with season 4. I'm Dr. Edith Bracho Sanchez. Thanks for listening.